Hi, good evening, good evening, good evening. Welcome to those who are watching live on the web right now. Welcome to those who are joining right now. Thank you so much for joining. Hope you guys are having a great evening. Thank you to my replay viewers who are on right now. I hope you guys are having a good night. So what we're going to be talking about today, I've been doing a series on the NCLEX exam. And what we're going to be talking about today is what to do if you fail the NCLEX exam. Okay, so I will give a minute for some people to join right now because I know there were some people that really wanted to catch this message. But first, let me go ahead and introduce myself. My name is Choma. I'm a registered nurse. I've been a nurse now for almost 6 years, so my background is in medical, surgical, and telemetry nursing. I'm the founder of Choosing Nursing over at choosingnursing.net, where we help you to successfully transition to the nursing field. So, like I said, we're going to be talking about what to do if you fail the NCLEX exam. So if you feel that this is information that may be relevant or helpful to your followers, whether it be here on Periscope or Twitter or Facebook, whatever it may be, you can use this opportunity to share with them so that way they can hop on right now with the scope and they can ask questions and it can be even more interactive. So let me go ahead and turn off the music. Okay. Anyways, so first of all, let me first explain if you haven't caught any of my previous scopes before this. If you are in nursing school, or if maybe you just graduated from nursing, or you're just wondering about nursing, what the NCLEX exam is, the NCLEX, it's pretty much the exam is where you have to pass in order to get your license, in order to be a nurse. And I've been focusing mainly on the NCLEX RN exam to become a registered nurse. But I did do a scope before called the NCLEX PN versus the NCLEX RN, and I think I did upload it on YouTube. So my old videos are on YouTube, and that one you can just type in my name as well. Or you can as of the last scope, now all of my scopes now go to catch.me/nursechoma. So you can go on there if you ever miss a scope, and it will automatically get caught on there and you can watch the scopes. So that's what tonight's going to be about. Tonight I'm going to be focusing on the NCLEX exam. So I'll go ahead and get started. So one thing I want to give a little background is as far as the failure rate when it comes to people who don't pass. As of last year, the NCSBN, it shows that as of last year in 2015, there was about 12 to 14% of nurses who did not pass that were U.S. educated, which means that they got their education here in the United States, and they weren't able to pass as of last year. So I just want to give that some background on that. 14% may not sound like a lot, but you have to also keep in mind the fact that there's thousands and thousands of people around the world who are taking their exam. So that does equate to a large number of people. So the first thing I want to tell you though is that if this is you, if you have been in this position, you can first breathe, you can first relax. I know it seems like it's the end of the world, but it's not. I promise you, it is not the end of the world if you do not pass your exam. There are plenty of nurses, some that won't even admit to you, that have failed their exam, and there's some that have failed multiple times, but they're still successful nurses. They still go on to work and become charge nurses and get promoted, all that stuff. So it's not always necessarily how many times it takes you, just a matter of the fact that you get there. So I want to encourage you right now, just so you know that it's not the end of the world. You just have to make some choices. You got to do some things differently in order to make sure you pass the next time, right? Because there's a saying that goes, if you keep doing, you can't keep doing the same thing over and over again, otherwise you're going to get the same results, right? So it's the same thing. It's the same thing when it comes to the exam. So one of the reasons that I've discovered why some people don't pass the first time, or even multiple times, one of those reasons why is because they run out of time. Because they're really trying to make sure that they get the question, every single question, so they take more time on each question. But the thing about it is that when you run out of time, it's not helpful to your score. So what I recommend, this is something now that I'm recommending, and because I try to take all the principles and all the things that I use because I was able to pass the first time and equate it into simple formulas, simple strategies so people can understand. So one of the things I recommend now is that you don't spend more than 2 minutes on each question. So don't spend more than 2 minutes per question. And if I explain to you how I got to that math situation, it probably would just throw you off, to be honest. But I promise you, I use numbers. I use based on the minimum amount of questions that are typically on the exam and the most you can get and the amount of time that you have for the exam. Like, I used all that to determine, okay, based on this, then the most they should spend on each question is 2 minutes. So remember that, so you don't run out of time when it comes to exam. Okay, and then the next thing is that, let's see. So there's different measures that you're gonna take if you failed 1 time versus if you failed 2 or more times. So let me repeat it again. If you failed the exam 1 time, there's different measures that you could take where you could successfully pass it the next time, as opposed to if you have failed already twice or more times. And everybody is different. Like, everything I tell you, you know, it's not always going to be like the cut and dry for every single person, because I don't know how much effort you put in the first time. I don't know what tactics, what resources you use. I'm just giving you a general principle to stand by, or not to say, I should say stand by, just a general principle for you to rely on, you know, just for as a median. So typically, if you didn't pass the first time, you know, if you just more aggressively, for some people, if you're more aggressive with your studying, you maybe use more resources, whatever it may be, you can most likely pass the next time. If you're just more, you know, some people, they really just need that extra studying time. They just didn't, you know, spend as much time as they could have, or spend as much preparation as they could have to pass that first time. So for some people, if you're just more aggressive with your studying, then you have a good chance of passing it the next time. Now, however, if you have failed the exam twice or more, then this requires a higher level of investment. It's going to require a higher level of investment in you, because the longer you go without passing the exam, the more time, and the more times that you haven't been able to pass, the lower your chances are of passing the next time around, right? So you have to have a higher level of investment. And when I say a higher level of investment, one of the things I mean is your time. You know, like, you're gonna have to put in more time and effort. You know, you have to keep in mind that it's only a temporary season. So you have to put in more time. You're gonna need to use more resources, and you're gonna have to, unfortunately, you know, spend more money in order to get to that end result. Everybody is different. Some people, they can just buy a Saunders book and maybe a Kaplan book and just study from that for 4 weeks, and bam, they pass. Some people are like that. Some people aren't. Some people they really need more hand-holding. They need more education. They need more resources. They need more time. You know, everybody is different. So that's why I recommend that if you haven't been able to pass the second time, it's been more than 2 times, then it's gonna require a much higher level of commitment, of investment. Okay. And then one thing I always do believe, regardless of what I just said, is that I always believe that the sooner you get help, the better your chances are of passing. You know, you can, whichever option you want to go through, whether it's Kaplan, Hearst, you know, whatever it may be, but the sooner you get help, the higher your chances of passing. I've always believed that, and I'm never going to change my opinion about that. That's why I think it's great when people who haven't even taken it one time yet, they haven't even, or, you know, taken it all yet, but they want to invest in the Kaplan course, or they want to invest in Hearst, or they want to, you know, whatever it is, they want to invest because they don't want to fail it, you know. And so for me, I know me personally, I had a lot writing, and I didn't care how much I had to spend. I didn't care what it was, because I was focused on the end result. I know to me it didn't matter, because I was just focused on the end result. So you know, everybody, like I said, everybody has different reasons. But for me, I personally recommend that the sooner that you get help, the sooner you start working with a tutor, or you get a review course, whatever it might be, the better, and the higher your chances are passing. And the way you also see it too is that is that you're really, because some people, what they think, well, you know what, I don't want to spend money on the review course, or I don't want to buy this, or I don't want to buy the books, I'll just use my notes from nursing school or whatever it may be. You know, and the way you have to see it is this: you have to consider it, when it comes to the exam, you have to consider it as an investment. You know, everything that you're putting in, you have to consider as an investment. And the reason why I say that is because, and well, I'll talk about in the next points as well, but the reason why I say that is that when you don't pass the exam, you're losing time. That's the biggest thing. You're losing time that you're never going to get back, right? And that time that you're never going to get back, that's time that you could have been working, right? You could have been working and making thousands of dollars a month. And the average starting pay, you know, depending on the state, of course, the average starting pay for a new grad nurse, if you look at as an RN rate, not LVN, RN rate, is about $3,000 a month, right? So you have to see it that way. Like every month that you're not making money, you're losing money. And so you have to see it that way. You just lost thousands of dollars. So that's why I encourage you to think of it as an investment. So the next thing that I want to say, another reason why people are not able to pass as well is because of the education. I failed the RN excellent multiple times. I've been an RN for 23 years. I own a CNA. Oh, you want a CNA training? Oh, that's awesome. You know what? I think that's amazing. You know, I think that's so amazing that you created a CNA training and that you didn't give up. You know, there's some people, they don't pass and then they just give up and then they completely change a whole nother, you know, career, or, you know, they go back to school and everything. So I think that's phenomenal that you started a CNA training, and that's really awesome. What was your name? I missed your name. So another reason why is because the education that they received, right? If you go to the website, to the NCSBN, to their website, they have really good statistics on there, right? Thank you for the hearts. They have really good statistics on there, and some of the stats, it shows which schools have a higher passing rate and which ones have a lower passing rate. And I was surprised to see, because I do my research, and there's some schools, their passing rate is like 40%, 50%, and then there's others that are 80%, 90%. And I don't believe it's the student, it's the program. So that's why one thing I always tell people to do, if you're in the position where you're looking at nursing and you're not sure which school you want to go to, but you know you want to go to nursing school, one of the things I recommend. Oh, hi Dolores, nice to meet you. One of the things I recommend too is that you make sure that you check to see what their passing rate is as well. Check to see what the school passing rate. So obviously you want to take note of the cost and everything. You want to take notice of the demand and all that good stuff. But I highly recommend that you go on the website and see what their passing rate is for most students, and that will tell you, you know, if you're really in a good, adequately prepared program. So that's one of the reasons why is the education that is not as good. So that's why you have to be even more aggressive, right, with your studying. People who typically also, the statistics also show that those who get their education outside of the U.S. have a much even dramatically lower passing rate. So when this happens, you have to be, it's the same thing as well. You have to be, because, you know, I can't speak on different schools outside the U.S. because I didn't go there, obviously. But what I'm saying is that their education, it may not align with the type of level that the NCLEX exam is. So that's why they have to be more aggressive in order to make sure they pass. Okay. So, and then if you have questions right now, this is a good time to ask me questions. I'm just reading off my notes so I don't miss anything. Okay, so anyways, yeah, so and then all this stuff, everything I have on here, most of it, what I have on here, I do have another guide, and it's called What to Do If You Failed the NCLEX Exam. What to Do If You Failed the NCLEX Exam. And that one is also free as well, and you get that one when you, so I have two guides. So the first one is 10 mistakes that you must avoid so you don't fail your exam. When you get that one, you get the What to Do If You Failed guide on day 9. So if you get that one, then you'll also get this one too. So right now that's the only way you can get it. So if you haven't got it, and remember it's day 9. So if you just got that one, then you're gonna have to give it some time until day 9, and that's when you get it. But that one comes on day 9. And you can get that one you can go to the link in my bio as well, and you can get it, and you can click in the bio link and go to the website, and you can get it as well on there too. And that one's called, like I said, What to Do If You Failed. What to Do If You Failed the NCLEX exam, because I know there are people who are not able to able to pass. So you want to take a deep breath. The time that it takes, it's about 45 days. 45 days that you have to wait before you can reschedule for your exam again. And that means you have to get, your ATT score, all that good stuff all over again, right? So 45 days, that's the amount of time that it takes in order to be able to reschedule for you to be able to test again. And then once you get that, then you can retest again. And then you can do whatever measures you want to do now this time in order to pass your exam. And like I said, it's not the end of the world. Even though it feels like it is, it's not the end of the world. You just need to be more aggressive, and you need to act quickly. You need to, not to pressure you, but you need to respond quickly. You need to do something sooner than later. Don't think, okay, I'll wait 6 months, I'll wait 8 months, I'll wait a year. The longer you wait, the longer you drag it out, the less likely you're gonna pass. I'm just telling you right now. The harder it's gonna be. Like, it's gonna be more challenging to really get in the groove of the studying again, and really be able to get acclimated again, so you can feel comfortable enough to pass the exam. So that's why I really encourage you that once you are able to pass, act quickly. Don't wait 6 months, 8 months, 9 months, a year before you plan to take it again. No, come up with a plan, maybe like a 3-month plan. Okay, I'm gonna do this, this, and this. I'm gonna study for this amount of time. I'm in my first semester of honors school. Oh, congratulations, awesome. How long is your program? Is it 2 or 3 years? That's awesome. So yeah, so like I said, like, I would recommend, if you can come up with a 3-month plan, that's the best thing, really. Don't try not to drag it out, because I know I get a lot of people that have told me that it's been years and they haven't been able to pass. And it's harder because the thing about it too is that, like, maybe you do pass, but then now you have to really learn the language of nursing all over again, right? When you start working on the floor, and it's a little bit more challenging if you don't remember, oh yeah, how did they start IV again? Or how do I put up whole 5 semesters? Oh, awesome. Oh, wow, that's fast. That's really fast. Is that an accelerated program? That's really, so next August? What is it now? Oh, okay, not this August, so the following one. Oh, that's awesome. That's really exciting. That must be an accelerated program then. So yeah, so that's what I recommend, if you can do a 3-month. Oh, okay. Okay, that makes sense. Okay, that makes a lot more sense now. Wow, that's good. Congratulations. I'm glad you took that leap. That's good. I know some LPNs that actually just stay LPNs. So that's awesome that you're taking that leap and making that transition. I know it's not easy, but it's definitely going to be worth it. Okay, so one of the things that, you're so welcome. So one of the things I also wanted to tell you guys too, before I forget, is that I also, so if you've been on the website as of either yesterday or today, because one thing I do also do one-on-one tutoring, because I do one-on-one tutoring, and my one-on-one tutoring is, I don't do no, like, okay, let's just let me just tutor you for like an hour and that's it. ChooseNursing.net. So ChooseNursing.net. So like, I don't do that. I do comprehensive. I do, because I want to ensure that you pass. So I'm not somebody where, like, okay, let's just talk one time or good luck. Like, I'm not like that, so I do like a more comprehensive tutoring, like, and we do it for a course over weeks, and I provide you with worksheets and all that good stuff. But if you were on the website as of yesterday or today, it's closed right now. It's closed right now. My one-on-one coaching or tutoring is closed right now. And I will be reopening it again March 3rd. So that's gonna be, the first week of March. Because right now I'm at my max for the month of February. Because I limit the amount of people that I help one-on-one, because I want to be able to give all my attention to them and be able to, like, help them as much as possible. So as of this month, for February, it's closed. So you need a microbiology tutor. Oh yeah, you should be. I'm sure you could find a microbiology tutor through your program. Like, I'm sure that maybe there's something through your program or through the school. Because I remember microbiology was not easy. Microbiology and the one that I really struggled with, organic chemistry. I just, yeah, I needed a tutor for that, for those courses. Do you have any tips on, for learning all the bones? You know, for me, one thing I always tell people is that you need to identify what your learning technique is. Okay, you need to know how you best learn. So are you a visual learner? Do you learn best by looking? Are you kinesthetic? Do you learn best by touching things? Are you an audio learner? Do you learn best by listening? So you need to first identify how you best learn. So for me, I best learn through visual. So for me, by looking at pictures, I learn best that way. Or if you're learning the bones, I learn best by going to classes, like going to like lab work or clinical hours afterwards, right? During my free time, and literally touching up on the bones and, you know, matching the bones and figuring out which bone is this, what does this bone do. I learn best by looking at the, like, you know, and playing around with it. I did the same as also with anatomy and physiology. I learned best by touching the cadavers. I didn't like it because I thought they smelled bad, but I learned best by touching. So I always tell people, you need to identify what your learning style is, and then apply that. You know, apply that. Yeah, you're welcome. And then apply that to what, you know. And for me, like if you're an audio learner, well, maybe what will help you is one of the things too is that maybe you have what do you call it, like a voice recording on your phone. Or if you know, I remember back in the day, we used to have like cassette tapes, whatever. So we used to take that to class and record the instructor that way, right? Yeah, I know, right? Back in the day, now we use our cell phones. So if you're an audio learner, maybe you could record your instructor teaching, and then when you're at home, listening to that. So, you know, everybody's different. So I always recommend that you first figure out what style works best for you. So yes, that was really it. I just realized, like, let me see. So what did I want to, let me give a quick recap. So like I said, if you fail the NCLEX exam, it's okay. It's okay. You just need to be more aggressive with your studying, with your resources, with your time, and know that there's a lot of people who don't pass but still become successful nurses, and it can still definitely be you. And don't allow that to discourage you at all. Don't allow that to discourage you at all, okay? So if you haven't already, like I said, you can get the guide, what to do if you fail the NCLEX exam. You can get that guide, and that will give you a step-by-step guide, as well as links, and then resources as well. And you can get that when you get the 10 mistakes that you must avoid guide, and you'll get that on day 9. All right. So that was it. I think I might hop on again after this. Maybe maybe I said too soon. I might, maybe not. You'll see though if I do. So that was it. Thank you for joining, and thank you for watching, and thank you for sharing, and thank you for the hearts. So I'll talk with you guys later. All right. Take care. Bye bye.